This morning we are joined by Dr. Steve Lindheim. And Adriana, you are from Arizona Reproductive Institute, and you have a lot of information to share with us, important information. So thank you so much for being with us this morning.
Thanks for having us.
Of course. Now, doctor, tell us a little bit about yourself, your background. I understand you come from Ohio all the way to Arizona.
Midwest. All right, I like it.
There you go. Badger country. I came from the Midwest because we were given the opportunity to set up a program that was real unique and delivering care in a very specialized way. And so being able to do that in a consumer, customer-based, individualized program was really exciting for me, and to bring on people like Adriana to deliver that.
It's a little warmer here too, right?
Just a little bit.
Why don't you tell us a little bit now about the Institute and everything that you offer? Because it's very extensive. I went onto your website, and it's very, very interesting.
Well, for comprehensive services, I'd like to say that all the way from the most advanced, where we put eggs and sperm together in a laboratory. We have an on-site lab director. I believe it's the only one in Tucson where we have that dedicated service. But I'd also like to say that we offer a full range of services, all the way from the real simple infertility patient that maybe just needs weight counseling and can help her get pregnant, and all the way to reproductive surgery, a lost art in my industry, and then to the in vitro fertilization process. So it's really exciting that we can offer the full scope of services.
And I understand there have recently been some changed views as far as fertility evaluations and when those should be done. But first of all, can we back up and talk about what a fertility evaluation consists of and why those should be done?
Well, we break it into 4 simple little things. You need eggs, you need little soldiers, you need plumbing, fallopian tubes, and you need an oven to carry everything. So those 4 basic things, believe it or not, cost about 1 in 7 to 1 in 8 couples to experience infertility. So it's really amazing that those 4 simple things can create that much of a problem.
Wow. And now, I know that you would think in theory that getting pregnant is pretty easy to do, but like you said, if there's a disconnect between any of those, 1 in 8 couples really suffer from that, and that's shocking. So what are some things that people can start doing, or precautions that they should be taking right now?
Well, you know, it is very interesting that the socio-demographics of society has really changed. When my mom and dad were having babies, they did it real early in life, and now a lot of people get married later. There's more effective birth control, there's more divorces, remarriages, so it's sort of changed everything. A lot of people are delaying childbearing until they get their education done and then go and have children. And as a result of that, the definition of when you should seek fertility evaluation has really changed dramatically. For women less than the age of 35, we say actively trying, and then if you can't conceive, you should seek evaluation. But that has really changed in women between 36 to 39, where we now say, if you can't get pregnant in 6 months, come and see us. Oh, wow. And after 40, it's 3 months. And the big reason is that men are spared this. We don't develop menopause until we're about 55. But surprisingly, the change in women's lives, or the early signs of menopause, really starts at 35, and that's a slight reduction, a gradual reduction in monthly fertility that we see at 35, and that's why we're much more aggressive in terms of seeking evaluation and potential treatment.
And you mentioned how crucial Adriana is to your practice. Adriana, could you speak a little bit to what you do?
Yeah, my role at the practice is to serve as the nurse coordinator, so my job really is to serve as the party planner, as Dr. Lindheim likes to call me, and coordinate an egg with the uterus, with the soldiers, with a woman's cycle, and make sure all those components come together at the appropriate time to make the best possible successful outcome for our patients.
Soldiers, that's a technical term.
I think that she's underestimating how valuable she is to the program and to me. Without someone like her, that makes it really easy for patients. It's such a stressful situation. We treat couples from all over the world, couples nationally, and even, you know, a lot of local patients. And just putting all of that together without someone like Adriana, I'd never be able to do it.
And let's talk a little bit about the patient experience, because like most things in life, when it's uncomfortable for us, we tend to brush it under the table or pretend like it doesn't exist. And this is something I think that can be very uncomfortable for couples to experience when all of their friends are getting pregnant around them and they make it seem so easy.
I think there's a lot of social taboos about fertility. People are afraid to talk about it. They're afraid to tell their parents. They're afraid to tell their friends. Perhaps partners are reticent, reluctant to bring it out in the open. And I think that as a provider, whether not as an infertility specialist, but as the obstetrician gynecologist, that we really need to be proactive and start asking the patient when she wants to be proactive in terms of thinking about fertility. And it really should start around the age of 30, 31. And like, when are you thinking about doing it? And it's really amazing that we can even bank eggs now for women that aren't in significant relationships, where we can bank the eggs for future fertility. So we can offer so many things, but you have to be proactive. And unfortunately, with advancing reproductive age, it's harder to treat women with their own eggs unless you're proactive in terms of treatment.
All right, good information. Thank you very much for being here.
Thanks very much.
The Arizona Reproductive Institute is on East Skyline Drive. To learn more about them, you can call 222-8400, or you can go online to arizonareproductiveinstitute.com. Again, that number is 222-8400 or arizonareproductiveinstitute.com.
And don't go anywhere. The Morning Blend will be right back.